E. coli itself is a gram-negative, rod-shaped, facultative anaerobic bacterium that was discovered in 1885. It usually gets around by flagella or cilia, which you can see drawn. It is normal to have a small amount of E. coli in our intestines. This helps keep the bacterial organism within our stomach healthy and alive. Now, we do know that E. coli can be seen in foods like lettuce and or meats like turkey and can be transmitted to us as we eat them if the foods are not properly cleaned and cooked. If this happens, one of two things may occur. The first thing that may pop into your mind that would occur is like the Chipotle incidents, where you get sick immediately and may just have to let it run its course. Some symptoms that may be seen during this time is diarrhea, upset stomach, chills, as well as nausea. Now, another outcome of E. coli being ingested due to uncooked or uncleaned food will present itself as a bacterial overgrowth in the intestine. This can appear between 1 and 10 days. During this 1 to 10 day period, a number of things happen to the intestine. The main thing that happens, though, is that the E. coli overgrows, taking over the entire gut system in our bodies. This leaves no room for any other healthy bacteria to grow. One of the first symptoms that may form is just the overall feeling of being sick. You may feel headache, nausea, or chills. One of the next big symptoms is the usage of the restroom. This may take one of two forms. A person may either have an increased need to use the restroom and may experience symptoms like diarrhea, or they may feel constipation and not be able to go to the bathroom at all. Another symptom could be seen in the form of eczema or rashes. These may develop on the face, on the neck, on the arms, behind the knees, any joints. You may just see a rash or become itchy with eczema-like symptoms. The final symptom, and the most predominant one, is the pregnancy appearance. The stomach tends to bloat extremely during SIBO cases. Many people go undiagnosed with SIBO because they cannot relate these symptoms to each other. But it is encouraged that if any of these symptoms are experienced, you should go see a doctor. One of the main tests that is done for SIBO testing is through drinking a cream soda-like substance. This substance helps detect methane and hydrogen levels in the gut over a period of time. Once the solution is fully drank and in your system, you have to take a breath test every 30 minutes for approximately 2 hours, or until the lab gets enough results or sees a relevant spike in either hydrogen or methane in order to determine if SIBO is what you have, as well as which type of SIBO that you have. This is the predominant way of testing, but unfortunately, due to COVID, there has been other tests that have been implemented to have less contact with breathing near other people. And this is done through a stool sample. Once the stool sample is given, it is mixed into 3 separate vials testing for hydrogen, methane, and other bacterial levels that may be seen in the gut. Results take approximately 3 days from both tests, and it is encouraged that patients follow a liquid diet until SIBO is detected. Coli-related SIBO follows a liquid diet during this time because E. coli grows off of fermented foods, and if fermented foods are eaten, symptoms may get worse. A person may be experiencing either diarrhea or constipation during their SIBO diagnosis. If they are experiencing diarrhea, they will probably have hydrogen-induced SIBO, while if they're constipated, they may have methane-induced SIBO. The reason why one is called hydrogen SIBO and one is called methane SIBO is because of the type of gas that they each release. Hydrogen SIBO is treated with a prescription that must be taken 3 times a day for 2 weeks. Methane-related SIBO is a little bit harder to treat and requires that same antibiotic 3 times a day for 2 weeks, as well as another antibiotic 2 times a day for 2 weeks. The reason why methane-induced SIBO needs 2 antibiotics is because while the E. coli bacteria is overgrowing, there is also some archaea properties that can be seen within the methane, and therefore there needs to be a little bit more aggression in regards to maintaining the bacteria overgrowth levels. This medication has said to be good to treat SIBO for at least 6 months. In some cases, people don't have any other symptoms of SIBO ever again and can live perfectly normal lives. But in other cases, most people will tend to have symptoms again after the 6-month marks. The symptoms are the same as they were before in regards to feeling sick, whether it be with chills, a headache, nausea, as well as a bump on the belly or a very swollen belly, and eczema on the body. These symptoms may be just as severe or may be slightly more mild. Either way, you should probably have the doctor reevaluate you even if you aren't feeling symptoms, just to make sure that you don't need to be on antibiotics again. If after being reevaluated by your doctor, it shows that you have SIBO again, there may be more than just a one-time incident of things that you need to look at to see how you can prevent it or at least lessen the symptoms for the rest of your life. These may be diet and allergies and may be done through different modes of testing for different foods as well as different tolerances that your body has. Now let's talk more about E. coli and SIBO together and some of the statistics behind them. Currently, there is an unknown percent of the population that develops SIBO each year. This is still a new and upcoming autoimmune disorder, only affecting about 6 to 15% of people in America, and that is for both diagnosed as well as their predicted undiagnosed. SIBO is treatable, as you saw earlier, with 2 different types of medications, but it may reoccur. There may also be underlying conditions that cause SIBO. This is something very popular. People with thyroid issues tend to have SIBO, or people with celiacs or IBS also tend to have SIBO. SIBO is not transmitted through contact with other people. It is simply transmitted through eating food contaminated with E. coli. Now let's go through a quick overview of everything we've just talked about. E. coli is normal in the bacteria of the intestine. It is something that should be there in moderation. If food is eaten that is contaminated or undercooked that has E. coli bacteria overgrowth, you may either experience some flu-like symptoms for a few days, really bad stomach bug, or you may develop SIBO, which is something that may reoccur for the rest of one's life. Symptoms include either extreme diarrhea, constipation, hives, eczema-like symptoms all over the body, as well as an enlarged, swollen, and hardened stomach. SIBO can be tested in a multitude of ways, the most popular being a breath test. However, due to COVID, a stool test is the best way to detect SIBO. There are 2 different strands of SIBO, one that is hydrogen-based and one that is methane-based. Both are treatable with different sets of antibiotics. You should get rechecked in 6 months if symptoms start to occur. Otherwise, if no symptoms occur, you should still go and have a checkup just to make sure that the E. coli has not started to overgrow again. If it does reoccur, it may be due to a diet or different food allergies that you were unaware of and therefore should undergo further testing. SIBO is affected on a multitude scale of people all over the United States. Many people do not even realize that they have SIBO and they just pass off these symptoms as something that they ate, not realizing that this can be fixed. SIBO can only be transferred through people who have eaten contaminated or undercooked food and is a public health issue because many people are living with SIBO and maybe unaware of what SIBO fully entails as well as the proper way that it should be treated.